I started dancing when I was 4 years old. I dance 5 days a week, 4 or 5 hours a day. I've been very passionate about dance since I can remember. I can't imagine life without dance.
She started competing, so I guess at the age of 5. I think she could probably relate every life-changing event somehow to dance. Dance is a sport. It's hard on the body.
I think I was 13 years old whenever I first started feeling pain. Every time I would dance, it was just painful. I was just scared because every doctor I went to, they never gave me an actual answer, so I just didn't know if I was going to be able to dance again. So
we took her to an orthopaedic who suggested, to go see another doctor. We had gone to probably 3 different doctors. So they were saying, the labrum was torn and they could repair it, or to have the major surgery. But nobody would tell us exactly what we were supposed to do. We were referred to Dr. Van Nortwick, and it was a blessing in disguise. We'd brought all the medical records that we had, and she said, no, she said, if you repair the labrum and you don't repair the overall issue, that labrum is going to continue to tear. So maybe 2 months down the road, it's going to be torn again. It was a hard pill to swallow, but I think for her body and for what needed to happen down the road, it was the best decision. You never want to go through a surgery, but you have to have your mind open and you have to have the resources, Thank God for MUSC and Dr. Van Nortwick.
Lily came to me having not been able to dance for about a year, and she's a high-level dancer. And this is often the type of symptoms that patients have. They're great athletes, and all of a sudden they have a lot of pain and are not able to do the things that they love. Lily has hip dysplasia, or a malformation of the socket of the hip and socket joint, the hip. And this usually tends to cause pain that is onset in the teenage years. It's not something that develops as a baby, as we often think of with developmental dysplasia of the hip. This is a different condition or a different type of hip dysplasia that develops later in life. The operation that I offered her was a periacetabular osteotomy, often known as a PAO, just because that's a lot of words to say, but it essentially reorients the acetabulum, or the socket portion of the joint. It's a really powerful operation that can restore normal anatomy and give a patient their native hip, but a good native hip that won't wear out and get arthritis, and also let them go back to the activities that they enjoy doing. If the candidates are chosen correctly, and as a pediatric orthopedic surgeon, I'm really lucky because most of my patients are younger, and they're actually the best candidates for this procedure. If you're having symptoms, it's a good idea to get checked out, and really the earlier we catch it, the better the long-term results. Once the osteotomy is healed, the new anatomy of the hip is there, the bone is fully healed, so she can do absolutely anything she wants to do without restrictions. Lily had not addressed her hip dysplasia, or it was not recognized, and if they don't end up in our office, these are the type of patients that go on to early hip replacement. She should not need any more operations, hopefully, for the rest of her life.
Now I think she's doing really well. Physically, she's come back full swing and then some.
Just a year after surgery, I was Clara in the Nutcracker on point. It's the main role of the Nutcracker. I'm very thankful that I'm able to dance again. I don't know what I would have done if I didn't have the surgery. I can do everything that I did before surgery again, yeah, if not more.
Watching her persevere through this series of events in her life, I think whatever she decides to do, she's going to do it, and she'll do it brilliantly.